when you obviously are out here creating enough problems, you've run in a ditch a number of times, or you've got a bunch of DUIs, or you've had the police called to your house for a number of times, at some point or there's a meth lab in your house, or any number of scenarios, you have court involvement. And the court involvement with us tends to take the course of drug court. We have one of the larger drug courts in the state of Kentucky. We're funded by the administrative office of the courts, and we have drug courts in every office.
Right.
And the program tends to run somewhere between a year and 2 years, depending on the progress of the client. Unfortunately, sometimes that's the only way that these fellows, or women, as the case may be, we have both men and women in the program, they've come to the conclusion that they need help. It's you know, as a friend of mine says, when you look at yourself in that stainless steel mirror in the jail, you're forced to take a really hard look at yourself. And sometimes that's what it takes, unfortunately.
Exactly.
Unfortunately, some of these folks also come out with a criminal record, and as often a felony, which in fact.
Well, you know, there might be some people watching under the sound of our voice right now that really need these services. And you know I've got family, and you've got family. We all know somebody that's affected by drugs, alcohol, or some type of addiction. What are ways that we can encourage the community to get free from this?
Okay, the first thing is, if you know someone that's got a problem, you basically confront them. And you have to be pretty straightforward. You know, Mickey Mouse, mealy mouth ways of saying things is not going to work. You know, if you watch the intervention shows on television, they're pretty straightforward.
Right.
Again, if there's enough discomfort in this person's life, he's going to want to make some changes. And again, like I said, we've got 11 offices. You know, if anybody, you pick a place in our region. And in fact, if you pick a place in Kentucky, there's 15 comp care regions in Kentucky, and there's probably, I'm going to say, there's probably an office within easy driving distance of almost anybody in the state. And that's, again, the program is funded in part, you know, it's a sliding scale. If you come in, you've got some resources, we expect you to pay, obviously. You know,
right.
You come in, you say, look, you know, I've got the clothes I've got on. We've had people enter our program literally wearing hospital gowns, and that was all the clothes they had. Right. It's all their worldly possessions. You know, so we have not, proudly, our director, Danny Jones, has made it early in his leadership that we wouldn't turn anybody away due to cost. And I've been doing this, well, I've been with CompCare here since '78.
Right.
And I can honestly say we've never turned anybody away who can't pay. You know, if you walk in and you say, look, I got to get some help, I don't have any money, that's fine.
Now, what do you all do? Do you all keep the patient there, or you just counsel the patient, or how does that work?
It depends on which track you're in. Obviously, you got some folks that are an outpatient. Outpatient is when you walk into the office just like you'd walk in your doctor for treatment.
Okay.
You walk in, you have a set appointment. You walk in, you see your therapist. You may see the doctor. There's any number of folks you may see while you're there. You may be on medication. You may get vocational counseling. A lot of our folks are working on getting their GED. Right. Getting a little further down the road educationally. Then we also have residential programs. The residential programs, now those are the three that I named earlier, Crossroads, Independence House, and Recovery Kentucky, and Cumberland Hope. You live there. Independence House is a relatively short-term program. Cumberland, Crossroads is a relatively short program. They do have a 90-day track, a 30-day and a 90-day track, but Cumberland Hope is a long-term program. You go there and you live for about 2 years, roughly.
Right. And so they wean you off these major hard drugs.
Yeah. You know, on television, you watch television and you see all this stuff with meth. And everybody goes, oh, meth is terrible. And meth is a serious problem in our area.
Right.
But the three big drugs in our area are pain pills, benzodiazepines, which is Valium, Xanax, that family, and alcohol. Meth is actually a fairly down the list. I mean, I'm not denying how pervasive and how damaging it is, but the truth of the matter is prescription medications are much more a problem in our area
Right.
than illegal drugs.
And you know, these drugs got such a hold on people in our community that people will honestly even hurt themselves to get more painkillers.
Oh, I was outpatient counselor in Manchester for about 25 years, and some of the stories of people that would, things that they would do to get the medication are just crazy. Some of it is.
It's heartbreaking, especially when you see these young kids that have a full life potential and just throwing their life away for drugs or the good time.
Yeah. Well, you know, again, it goes back to the addiction process. They, at some point, lose control. When, you know, people say, well, you know, they threw away everything. That's not important anymore. Getting the drug is what's important, and that's where that we try to intercede. If you can intercede in someone's life before they become full-blown addict, you've got a really good chance.
Exactly.
Once the addiction process, then that's where the work starts. You're not, it's not hopeless by any means, and there's a ton of folks that have recovered even through addiction.